Ever feel that sharp twinge in your knee when you're walking up or down stairs? Or hear that weird popping sound when you squat? You are not alone. Knee pain is a common injury and, in my opinion, one of the easiest joints to rehab if you're doing things right, because it is rarely just the knee. What's going on, y'all? Allow me to reintroduce myself as Dr. Jenny Ochoa here. I got married. I am no longer Dr. Jenny Brennicke, and I am now Dr. Jenny Ochoa. So woohoo to me, the licensed physical therapist here to give you the no BS beginner's guide to knee pain. By the end of this video, you'll learn what might be causing your knee pain, because spoiler, it's not always your knee, what to try on yourself, when it's time to get that professional help, and what kinds of things actually really work. So first, let's talk about the anatomy of the knee, because all the knee is a hinge joint. It just bends back and forth, and then it does a tiny bit of rotation. But here's the thing, it's sandwiched between two super important joints, your hips and your feet. If either of those are unstable or weak, your knee takes the damage. There is a huge relationship between our knee, our hip, our foot, AKA that is our entire lower connect chain, and knee pain rarely exists in isolation. Weak hip abductors, glutes, foot instability, or overpronation can cause medial and lateral knee overload and stress on structures like your meniscus, your ACL, your patellar tendon. It's not random, it is mechanical. 99% of my patients that have knee pain encompass these two things. One, it is glute medius weakness, and two, overpronation or flat feet because they lack the foot awareness and stability and strength. This is gonna cause overpronation, which is gonna cause internal rotation of our tibia or our shin bone. This puts a valgus force on the knee and causes it to cave inward. This stresses the medial meniscus, the MCL, and causes that knee cap itself to actually track improperly. With a weaker glute medius, now it's the opposite. The femur internally rotates and the adductors take over, and the same stress is put on the knee every single step you take. In my opinion, where I think the rehabilitation process with the knee fails is a lot of people think more is better. More reps of towel scrunches, more reps of clickbacks, clams, all these side glute strengthening. But again, it's not about what you do, it's how you do it. So here we have Donald. He has bilateral meniscus tears in both of his knees. He never got surgery and he rehabbed it all on his own with a little bit of my help too. But what would you say are the top 3 things that have helped you stay out of pain with both of your meniscus tears?
I think the top 3 things that has helped me is glute strengthening, stretching out my quads, and rotational work.
Okay, so there's some good ones. When you typically do have your pain, where do you feel your pain when you have those? And is it different right versus left at all?
Usually I get pain on the side of my knees.
Okay, on the sides of them, the
lateral sides.
Okay. Do you ever get any like kind of joint line pain anymore, or that's not really too much?
No, not at all.
That was originally when he had a lot of that pain. He would get right on that joint line. That's pretty typical for meniscus, but now he's definitely dealing with a little bit more what we call our lateral IT band. That kind of comes down is the upper part. So we're going to talk about the release of that as well. Whether you have meniscal tears, ACL injuries, or patellofemoral pain, or just knee pain out of nowhere, location of your knee pain can tell you a lot of the information. So typically with medial knee pain, that can be a lot from our adductor overusing and weakness in our side glutes. You know, that's going to be our side-to-side motions. So sometimes people will feel that medial knee pain. Laterally, that's going to be more from our IT band as it comes down and our lateral quadricep. For Donald, he has a little bit more what we call our lateral retinaculum, which is essentially as it comes off into the IT band and it touches into that kneecap, and it can track that knee a little bit more laterally. So we'll talk about the release for that lateral retinaculum. Regardless of where your knee pain location is, it really actually does not matter, because we need to look at the knee as a whole and get that surrounding upper and lower joint involved, and that's going to incorporate releasing, stabilizing, and strengthening. For the release, a good technique that you can do on yourself, sometimes giving you immediate pain relief, is a GTO release. A GTO release stands for Golgi tendon organs. Those are essentially our receptors to pain and stretch. Everywhere in the body, we have what we call our musculotendinous junction. So in the knee, the muscle belly comes down here, and right about here is where that muscle turns into a tendon to then wrap down underneath that kneecap. And so in that musculotendinous junction, we have those GTOs. Those are essentially our receptors to pain and stretch. They act as like a protective role in the body that when there's too much tension around the knee or around those musculotendin junctions, they activate and overactivate to provide a stimulus to our brain of a pain signaling, and that can increase our chance for injury because we have those GTOs online just a little bit too much. So to release those GTOs, I'll show you on a way passively, and then I'll show him how to do it by himself. But basically, you're just finding those areas around the kneecap, and you're just gonna tack it down while you move your knee. So Donald, I'm gonna have you move your knee back and forth, basically just back and forth, trying to release those GTOs and just kind of showing the brain, hey, there's no threat to moving our knee. It's perfectly fine if you kind of mobilize those. And you can also bring it up onto the table. So I'll have you bring your leg up here. And then now what we're gonna do is same kind of thing, is tack down those areas. So for him, he said it's all on that lateral side. So like we talked about, you kind of have off that IT band that is called a lateral retinaculum that attaches into that kneecap, and it can cause that kneecap to track improperly. And when we have that kneecap tracking improperly, it's kind of like railroads on a rail track. If it's not in its right groove, it's gonna be tracking improperly. That can also increase pain and get those GTOs signaling a little bit more. So like I said, tack down those GTOs. It's right on the top of that kneecap. And now what I'll have you do, Donald, is slide that heel across the table. So you're helping me about 20-30% while I'm doing most of the motion, and you're just going up and down. And he already grunted on it because you can feel those little structures in there that we're releasing. Okay, and you're just going up and down, quality over quantity. And like I said, this is good to do more passively on yourself, but I'll show you a way that you can do by yourself and get that immediate relief. So you're just going up and down, and you're just scanning all around the kneecap. You're trying to find those areas that kind of hurt so good and that give you that most pain signaling, and just kind of work through them a little bit. You'd be surprised that the first one's really painful, and then it kind of gets better over a little bit more time. Okay, so this is how to do it with someone, but I'm gonna show you here now how to do it yourself. So I'm gonna have you sit up on the edge, swing your legs over off the side. So to do that kind of release on your own, you're gonna do the exact same thing that I did. You're just gonna try and find those areas, you're gonna tack down that area, and you're just gonna bend your knee back and forth. Kind of bend your knee, bring it into full flexion, all the way back as far as you can, full extension. Maybe do like 1 or 2 in that area, and then you can kind of move around, scan a little bit more to the side. All in those areas, like I said, finding those areas that kind of hurt so good and you get the most relief. Okay, this would be good to be doing if right when you have that pain in that knee. Try a couple of these, see if that helps that pain. If not, then we'll show you some exercises that you can try as well. How does that feel for you?
Feels good. A lot of popping going on.
Sometimes popping is normal. That just kind of shows our brain, hey, we can move, the body's fine to move. As long as you don't have too much pain with that popping, that's okay. But it's not abnormal because we're tacking a part of the tendon down as it attaches down to that knee. So it's not an abnormal thing to get a little bit of popping. For further releasing structures around your knee, like he talked about, one of the best things that helped him was keeping his quad stretched and loose. Specifically, our longest quad muscle, our rectus femoris. A lot of people don't know that this muscle is a 2-joint muscle. So it spans both the knee and the hip. So this muscle, this is why that relationship between hip flexors and knee pain can kind of be married together. It's because that long hip flexor attaches all the way at the deep part of our hip, comes down to attach the bottom of that kneecap. So the tighter that muscle belly is, the more it's gonna pull a little bit more, sometimes in that inferior kneecap. Before we go into further releasing the quads and hip flexors, I first recommend that you test this muscle length to determine if this is something you need and it might be a cause of your pain, because the last thing we want to do is things that don't actually make a difference. My favorite way to test this is the Thomas test. I made an entire hip flexor video on this, so be sure to check that out and determine if that hip flexor length or that quad length is a dysfunction for you. You do not need to go research a ton of quad stretching exercises. One of my favorite one is the couch stretch. It's one of the best ones because it gets that hip into extension, it gets that knee fully flexed, and it's gonna help you get that rectus femoris stretched a little bit more. Go watch my hip flexor video. We've talked about this before. You don't want to just lunge forward. You want to think about squeezing that glute and tucking that pelvis underneath to stretch those hip flexors more so, get into that posterior tilt. I do want to emphasize that this is purely educational content. It is not a substitute for medical diagnosis. If you want to get to that root cause, that is where my one-on-one online physical therapy comes into play. Head to revitalizerecovery.com, fill out the application, and we can schedule that online evaluation. For that stabilization piece, one of my favorite ways is take it back to basics. Let's practice that single leg stance and make sure we have that foot and the hip working together with the knee. So I like to add a band with this. So you're gonna add a band kind of at ankle height. And then we're gonna take our shoes off for this, okay? Because we talked about how important it is for the feet and the knee complex, so take those shoes off, okay? Then we're gonna put this band around our ankle. We're gonna take a little step out, give a little resistance. What this is doing is putting a force onto our abduction. It's forcing us to have resistance there. So we're gonna think about that Elvis position where we engage that side glute, we rotate out, we have that foot engaged, nice tripod position, toes are splayed, and then we're just gonna hold a single leg stance in this position, okay? Your body's gonna wanna pull and gonna go here like this. Those adductors are wanting to take over, but we engage that side glute, we get that knee in the right position, and then we just hold nice and straight. Okay, you wanna make sure you're not locked out like this. We want a little bit of bend in the knee, get those quads and those glutes engaged as we just control that single leg step. So you can really see on him, his angle of his knee wants to come inward. So yep, you really wanna think about kind of rotating out with that side glute and you hold that. You almost want your knee in line with like your fourth and fifth toe a little bit more outwards to make sure we're not getting those adductors too much involved and we're centering that to a little bit more glutes. So you'll see he's a little more shaky. You're gonna have a little bit of rotation of that knee. This is something that you can incorporate 2 to 3 times a week to help that single leg stance, because that's what's really gonna help that foundation of that knee. We talked about it's very important to get into that lateral and rotational plane. I've shown you guys this one before, a rotational step up where we keep this knee in the right location and then we rise up and come over that body. When we rotate and come back down, we're keeping this foot nice and fixed. We're keeping this hip outwards as we just engage and come up over that fixed knee. Another strengthening exercise that's really good is an isometric lunge here. So with this band, essentially this band is translating that tibia forward. So it's gapping that knee joint. So what we're gonna do here is we're gonna get into a lunge. So bring that last leg up. You're thinking about this nice tripod position, having the arch engaged. And every 10 seconds, all we're gonna do is we're just gonna drop down. So we're gonna get a little bit lower. And what this is doing is it's isometrically loading us. This is really good for our tendons, that inferior tendon underneath here. Another 10 seconds, drop down. Just hold nice and strong. Keep squeezing your quads. That's the main focus, this isometric engagement exercise. And last one, 10 seconds lower. And you're just holding as this gaps our joint a little bit more forward and loads that tendon a little bit differently. For this next stabilization exercise, we're gonna take that concept of keeping that foot nice and stable, and we're gonna practice it here. So you're gonna get a heavy kettlebell, a weight, something that you can put a band underneath, a nice light band. And then you're gonna stretch that band and we're gonna put it right underneath our big toe, okay? Because we're working on that big toe strength too. We're gonna think about that Elvis position to give us that arch of that foot. We're engaging through in there. And then all we're doing is we're keeping that knee in that strained position and we're gonna go 5 different positions. So first we're gonna go straight forward, dropping that heel down. Then we're gonna go out to the side, straight up to the side. We're keeping our knee in the same position. Then we're going at a 45-degree angle back and across, and then straight back. And then our last one is a curtsy. So we're just tapping while we maintain that position in our foot, maintain that position in our knee. You'll see if you start to now collapse that knee forward, you're gonna lose that band a little bit more as you go out in different positions. So you really have to keep that control a little bit more. So now you guys know how important it is to release and stabilize the knee when it comes to the function of it. So now we need to strengthen it. If you guys wanna know my top favorite strengthening exercises, leave a comment down below and I'll get that going for you guys.